Okay, Dr. William Curtis here again. I want to go ahead and start session 3 of the pre-diabetes reversing diabetes course. This is going to be the final of a three-session class where we're trying to work on the idea of how do we reverse pre-diabetes, kind of encourage weight loss, and kind of start a lifestyle that reverses the natural pathway to type 2 diabetes. So I think that's where we want to go. I want to make sure everybody's gotten in here. Let me say admit all. Got other people trying to get into this meeting here real quick. So go ahead and kick those on there. And make co-host. Yes. Okay. So we got somebody that's a co-host there. Perfect. Okay. So I want to go ahead and get started. Respect everybody's time here. Close. Yes. There we go. So in this topic today, in the first one, we talked about sort of what is prediabetes, what is the natural progression towards diabetes, both from a hormonal standpoint. And then later in the second session, which you can go back and review if you haven't watched it, you can look at sort of the nutritional factors that trigger problems with our hormone system that lead to diabetes. So this has been the coursework so far. You guys that have been part of this have asked a lot of really good questions. And I think what will end up happening is we'll leave this class open for a week or so that if there's additional questions or people that want to really go back and delve through it, they can ask questions later. Because anybody interested in weight loss, anybody that's trying to reverse their progression towards diabetes is going to be important. But today, in this session, I want to tackle factors that people often ignore, misunderstand, or forget when they consider weight loss or they're trying to reverse prediabetes. This is one of these situations where a lot of times I've noticed when I work with patients, they get hyper-focused on the idea of, well, doc, I'm eating everything the way I'm supposed to. I eat low carb. I try to exercise. And they kind of run into roadblocks where it doesn't seem like they're making the progress they think they should, either with weight loss or, getting off medications or frankly, completely reversing diabetes. There's reasons for that. Our body habitus is very much related to what we eat, but there are many situations where it's actually other factors that could be causing this. One of those, it's kind of like if you're driving a car and you go, why is my car not going fast? And your parking brake is pulled on. Okay. It's kind of the same thing. You're like sort of have this natural friction or drag in your body sort of holding you back. There's natural situations where the human body is more prone to weight gain. Pregnancy is a good example of that. A woman that's trying to lose weight during pregnancy is fighting their own body's storage mode, hormonal balance that's going on. So there's situations where the body naturally will try to keep weight. Same thing happens as we get older. There's a natural progression to increasing body fat percentage and things that we have to work against. So let's get into the things that people might not think about. And I put these in an outline and I just kind of, I'll probably flesh these out once, what I've done with this class is every time I finish, we give the talk, we give the video, and then we come back and I add other links where you can explore this. That's why I want to leave this open where you can ask questions later as well, because I'm going to put some links to more details in each of these categories. The first and foremost is sleep. I didn't realize coming out of medical school how important sleep was. We all sort of know we need it. We know that it's life-sustaining, but sleep is something that has got a mountain of research behind it now that suggests it's heavily tied to both health and disease. The research is actually very clear that one must have 7 to 9 hours of sleep nightly to have optimal health. Anything less than that, very clear research on this, anything less than that, that doesn't end so well for you. Meaning if over a long haul, over your lifetime, if you're averaging 5 hours of sleep a night, you are going to have increased medical problems. I did a podcast a while back on the WFO Life podcast, which inside of the Future Focus Health Network, there is an entire tribe dedicated to that. So if you're interested in maybe hearing more about the WFO Life podcast, go to that tribe and check it out, look around. But I did an entire, what I think of as a kind of my definitive topic on sleep. And what I did is I reviewed a fascinating book on sleep and all the current research. And I I think I dispelled a lot of myths. You know, we talked about how the amount of sleep you have to have. We talked about how it affects your immunity, how diabetic control is worse, obesity, of course, insulin levels. All of these things are affected by sleep or lack of sleep. If you want to have a good, strong, robust immune system, you must sleep. And the skipping it, you can't really make it up. It's not like you catch up per se. It's just a tax your body pays physically and hormonally. It is considered a stressor, which is going to be the next topic I move into. So if you are struggling with weight loss, or you feel like you're doing the right things dietarily, or maybe you have low energy, and you look at what you're doing and you find that you're sleeping less than 7 to 9 hours, adjust what you're doing. I have done this myself, and I can tell you that I went from averaging about 6.5 hours of sleep to trying to press for 7.5 to 8 hours of sleep. This was at the suggestion of one of my mentors. And I was feeling tired, irritable, even some, kind of moody symptoms. 1 extra hour sleep a day on average, huge change. Motivation, energy when exercising, clarity of thought, mood, you name it, better. Increase your sleep to that 7 to 9 hour window if you can possibly do it. If you can get maybe some of that, take a hour-long siesta mid-afternoon. Actually, siesta cultures are healthier than others. So not a bad idea. So sleep. And by the way, sleep is also ties in, I didn't talk about it, but sleep apnea is another trigger. It's an independent risk factor for obesity. That's why sleep apnea is so important. If you snore severely, you notice people tell you stop breathing, or if you wear a fancy watch that measures sleep and respirations and pulse ox, and you notice it's giving you warnings in the middle of the night, please get tested. Sleep apnea is treatable. Sleep apnea is an independent risk factor for diabetes and obesity, meaning it alone can cause obesity and diabetes, and you don't have to be fat or overweight, so to speak, to have it. Skinny people can have sleep apnea. So think about that. The next topic is stress. Now, if people hear stress, they go, okay, stress, whatever. What does that mean? Stress is a hormonal event. It is an event where the adrenal glands, which sit above our kidneys, these little glands make a few hormones, but the main one is cortisol. Cortisol is your stress hormone. It's an anti-inflammatory hormone, so it's very similar to a steroid. Like a doctor would give you a steroid to decrease inflammation. That's kind of what cortisol is. But cortisol stimulates, it is stimulated when there's inflammation. It's stimulated when the body is stressed, and there's various reasons it happens. Very common stressors are pain. So if you have a chronic pain issue and you're struggling to lose weight, or you feel like you're tending towards diabetes, pain control and getting adequate pain relief is important. Otherwise, what happens is the body raises cortisol levels, which tells the liver to prepare for fight or flight. That's the fight or flight hormone. And what happens is it dumps sugar in the bloodstream, and your sugar's artificially high. This underlines why a lot of people will talk to me and say, Doc, I followed your diet plan. I've been doing everything, and I just don't seem to lose weight, but I got this chronic back pain, and it's really tearing me up all the time, and I can't sleep. Well, what happens is they're in a state of high cortisol all the time. And when your cortisol is high, whether you eat or not, your liver stored sugar. It's going to dump the sugar inappropriately into your bloodstream to prepare for a perceived fight or flight situation. Pain. It's painful. So pain is big. Insomnia. We already mentioned sleep. Insomnia. If you don't sleep 7 to 9 hours, say you're getting 5 hours of sleep at night, you're going to bed at midnight, getting up at 5 in the morning. By definition, humans are not meant to be awake during that time frame. So what happens is you're raising your cortisol every time that happens. When you raise cortisol, dump sugar, sugar's up, insulin has to rise, insulin stores sugar in the form of fat in your belly. This is how this works, okay? So moving on, social stressors. Rocky marriage, trouble with the kids, mom's giving you problems, emotional instability. These are all things that can trigger the stress response, which in turn can lead to weight gain or prediabetes. Financial stressors, stressors real or imagined. I imagine there's some people here that probably at times have been anxious about things. What about this? What about that? Not living in the present moment, kind of worrying about things in the future that may or may not ever happen. You can have things that are imagined stressors that will lead to this. Which brings me to the idea that you really have to have a process for stress reduction. Now, I'm going to link an entire article on stress reduction. Some of you may have seen that, but I want to link that into this topic because you need to have a process. For me, what I do is I exercise, which is one of our topics we're going to talk about today. But exercise is a form of meditation. It's something that lowers blood pressure. It's something that burns off extra stress. And it allows people to get that excess tension out of their body and think more clearly. So regular exercise is a form of stress reduction. Meditation, prayer, massage, simply sitting quietly, taking a walk in nature. There's a ton of these types of things. You can do biofeedback. You can listen to music. There's on and on and on. Yoga is another kind of physical thing that helps with stress as well. Tai Chi, Qigong, all of these sort of martial art, ancient practices tend to improve stress. Meditation, prayer, and exercise are some of my favorite ones that I have the most experience playing with. And I think that if you don't have a practice for reducing stress, if you don't, and it's a big problem for you, just remember it's like leaving the parking brake on. You need a strategy, okay? So you must have a practice. The next topic I want to get into is exercise. Now, exercise in many research articles that I've read is considered the sentinel habit. That means the first habit. When here we are talking about, weight loss, prediabetes, and sometimes people get confused on where should I start. Now, I like to start with diet, and that's why I've given you a few items and the challenges as these sessions have gone on, where we try to get you started making some positive change, some baby step towards the right direction. But exercise arguably could be what we consider the first habit that should be started. And you need to start somewhere with what you have, with what you got, and do what you can. So you don't need a gym. Here we are, COVID-19 situation. You do not have to join a gym. You do not have to expose yourself to large populations of people. You could simply go for a walk. But the reason this matters is because the research tells us that we only have so much motivation. And I know some of you have messaged me and you're struggling with various things in the diet and things like that, but we only have so much motivation. And the research suggests that if we can use our motivation, preferably early in the day, before the day gets away from us, if we could use that to get out and be physically active, it changes our brain chemistry. It changes our brain chemistry where other good habits follow much easier. So let's say, for instance, that you have a habit where you've gotten up and you go for a 2-mile walk, 3-mile walk every morning for the last 5 to 7 days. Let's just say that's what you did. Great. That's a wonderful habit to be in. The research suggests that your tendency towards cravings for sugar, alcohol, drugs, your tendency towards wanting to stimulate your body with things like caffeine is less in a person who exercises regularly. There's something that occurs with exercise, probably multiple hormonal changes that occur, that change how our brain behaves and how we react to the world and the things that we crave. I think it's important that you use exercise as a tool, both, as we mentioned before, for stress, but also for these sort of collection of benefits we get that have to do with cravings and sugar cravings and things like that. So very important that you keep that in mind. Exercise is also great for cardiovascular health. All the research I've ever seen on cardiovascular fitness and exercise, aerobic fitness, all says less chance of heart attacks, less chance of stroke, less chance of cancer, less obesity, less diabetes, just on and on, less depression, on and on and on. Who doesn't want that? Do you eat because you're depressed? That's a common thing that people have. Well, actually, exercise is better than prescription drugs for improving symptoms of depression. So maybe instead of, I'm not saying stop your pills or anything if you're on something, but go out and exercise every day and put it to the test. Maybe you feel better. At very least, you're starting to play that card. Like your health is like playing poker. If you're holding that card like, yeah, I don't really exercise regularly, it's like you're holding onto an ace and you refuse to play it. Please go do it. Humans are meant to move 12 miles a day. Not that you have to move 12 miles a day, but the reality is if you're doing some movement, you're getting some of that cardiovascular benefit. You're getting some of that longevity. I want you to be as healthy as possible for as long as possible and drop dead. Okay, that's the way I want people to live their lives. Healthy as possible without popping pills and not sick for 25 to 30 years as modern medicine now allows us to be. I want you to do the things that matter the most. And cardiovascular health through regular exercise helps reverse weight gain and diabetes. By the way, when you're working out, like let's say with weight or resistance training or doing cardio and you feel that burn, when you're feeling the burn, well, what ends up happening is that burn means that you've used up all the stored sugar in your muscles. Well, remember we talked about in the first lesson, well, when you have to get sugar out of your bloodstream and your muscles, you typically need a lock and key mechanism. That's what insulin does. It opens the door to allow sugar into your muscles. Interesting thing occurs with vigorous exercise. You don't need the lock and key as much. You don't need as much insulin. Guess what happens? You don't store as much fat. You reverse the reason the organs become damaged and the reasons you become a diabetic. The reason you gain weight. Back up from that a little bit. So my point is, when you feel the burn, when you've done enough where you say, man, I'm really tired, that was tough, I felt the burn in my muscles, that means that you just wrung those sponges out. And now you're soaking blood sugar right out of the bloodstream without needing to raise your insulin levels, which is, of course, reversing weight gain and diabetes. So I think that's real important that you consider why I'm asking you to do that. The other thing about exercise is consistency matters the most. You must be consistent. It will not work for you if you exercise twice a week, okay, unless you're running a marathon twice a week or something ridiculous. You need to be in a situation where when somebody says, hey, do you exercise? Of course I exercise. I exercise 4 to 5 days a week, no problem, every day. You know, good to go every day. It's of course I do. One other thing about exercise. Does this have to be like the gym? Does it have to be you're a runner? Does it have to be new equipment? Nope. If you're going to push a lawnmower for 45 minutes or an hour, roger that, it counts. Okay. I don't generally go for a run on the days that I mow my yard or on the days that I play soccer with my kids or the days that I did something vigorous beside, you know, it could be work, dragging limbs, doing whatever. If you're doing something physical where you're pushing and pulling, you're dragging things or climbing things or physically getting your heart rate up and you're doing that for 45 minutes, that's exercise. So if you want to garden, if you want to play with your kids, kick the soccer ball around, if you want to, you know, do things that are active outdoors like surfing, outdoor sports, you know, these types of things, that counts. Awesome. Enjoy it. If you're better in a gym because you like the motivation of seeing other people, then great, join a gym. But consistency matters. 4 to 5 days a week, 45 minutes is your minimum goal. You do that, you're getting all the benefits we just talked about. Now, I want to get into some lifestyle factors. These are, I don't know, let's lump them into social norms, things like that. The first thing I want to talk about when it comes to weight loss or prediabetes under this category is family. And I know there's someone listening that has probably situations where their family environment is such that it's sort of resistance to them changing diet and lifestyle. Let's say you're in a family who doesn't value physical activity. Well, when you say, hey, mom's going to the gym or mom's going to go exercise, who wants to go with me? Or these types of things, and you might get this negative feedback. You have to understand this is not for them. It's for you. You're valuable in your own right, and you need to do this for your own health. Besides that, if you have an inactive family, let's say you have kids or teenagers and stuff that they really aren't buying into, they need health issues. You can see where they're headed. Lead by example. Be a positive influence, not a nag, and focus on what you need to accomplish. Fix you first. It's kind of like the old, you know, you're in the airplane, they said, hey, if the oxygen mask drops down, Put it on yourself first, then help the person next to you. You have to help yourself first. You have to be the example, not try to, well, I can't do it because my husband says I can't, he won't go, so I don't have anybody, so I can't go. Please get rid of that voice. The other thing is, what if your family won't eat what you're cooking? If they won't eat meat, vegetables, and good fats, and they insist on processed food, fast food, again, focus on yourself first. Be consistent with this. This is your family. These are your loved ones we're talking about. But you don't have to fight that battle. But you also don't have to eat junk. That's your personal choice. Everyone has a choice. Sometimes in families, especially during holidays, there are cultural norms. Many families praise or they condition their family, their children, if they need comfort, that they eat things, preferably sweets and sugar. Be careful if you find that you have to reward yourself with sugar. Hey, Timmy, you played really well in the game. Let's go get ice cream. That's how it starts. That's the thing, that we have to go get something sweet to praise one another. We have to eat something, a treat or special thing that's sugary and things like that. We have to do that to celebrate. That's a cultural norm. It's not something everyone on the planet does. It is something that folks that have, large family histories of obesity and diabetes, it is a cultural normal there in many situations. So look at what your family norms are. Holidays are a great example. I have an in-law that, bless her heart, every year she makes this amazing millionaire pie. It's always Thanksgiving. And I think the first 10 years I was married, she would make it. Thanksgiving's there. She would serve it to everyone. She'd be this gigantic piece of it, and she'd bring it to me as an offering. Look, it's the wonderful millionaire pie that I made with love to you. And I remember thinking, look, I just ate turkey. I just ate stuff. I try to be healthy. And I try to be polite, but I would say, hey, listen, I think I can tell that you really put a lot of love and effort into this. I just don't want to eat that because it has too much sugar. I don't feel good when I eat that. And that's a cultural norm. And I actually had to fight about it for 10 years of my marriage before finally it was like, oh, okay, not such a big deal. Again, I'm kind of blowing that a little bit. It wasn't like we're fighting about it, or it was just kind of a thing that I remember. I recognized it. It was one of the things that I recognized for the first time. This is a cultural norm. This is something that this person is giving me this. They love me, and they made this thing, this made of sugar, to give to me. And if I don't eat it, there's sort of a social thing there. But the reality is that thing is not good for me. And it's poisoning my body and making me lose my goals towards weight loss and reversing diabetes or prediabetes. So I hope that makes sense when I talk about the cultural norms that we all go through. Holidays are one of those. Woohoo, it's Thanksgiving. Let's blow it out and eat junk for 2 weeks. Because it's not one day. It ends up being 2 or 3 weeks, right? And then we wake up and sometime it's mid-January and we don't know what happened. We've been in a sugar coma from, end of November all the way through January. It doesn't have to be that way. You can be more deliberate, and it doesn't mean you can't have that wonderful pumpkin pie, or maybe I want to decide to have that millionaire pie. You don't have to be, perfection's not the goal, but understanding what cultural norms you're living in are very important. Peer influences. Look at your friends. If everyone you're around is overweight or pre-diabetic, look at their habits. What habits do you share as a team, if you will, as a friendship? Maybe we need to look at what influences friends are having and activities we're doing with those friends. Maybe we need to get friends that are working on, have different habits. I'm not saying blow your friends off or whatever. I'm just saying be aware of the social and peer influences to the people around us, including family. Next thing I want to talk about is attitude and belief in yourself. I have a lot of people that when they come in and they're trying to lose weight or something, I got to lose weight for my daughter's wedding, or I got to lose weight because my husband, doesn't look at me the same. I got to lose weight because of whatever. And they've always got some external reason. A lot of times what that implies is that you personally are not worth being healthy. A lot of people have self-image issues where they really feel like I don't deserve. The little voice in their head is that I don't deserve to look good, feel good, be sexy, have good health. There's something negative about me that I can't do that. All these automatic negative thoughts that people have. You need to have an attitude of believing in yourself. I just did an interview on the WFL Live podcast with Rex Howes. Man, listen to that. If you have some of those negative voices in your head that said, I'll never succeed with this, or I can't lose weight, or I'm just everything around me is negative, or everybody's pulling me down. I can't make it. I can't make positive changes. Please, if you hear those things in your head, you can do this for yourself. You're the reason to do these lifestyle changes, not for anyone else, not for your husband, not for your spouse, not for your wife. Do this for you. And I think you will find that self-love, that activity, that the energy that you put into yourself will pay off. And then it's an internal motivation. It's not an external thing that might let you down. Because you know what happens? If you do it for some external reason, for the big wedding, the wedding's going to be over. Then what? It was the wrong reason. What if you do a bunch of changes and you drop some weight and you improve your blood sugar and you're feeling healthy and you feel good, and your husband or wife don't acknowledge it because they're unhappy, because they haven't made a change, and they maybe even are negative with you? What is that? Then what? You did it and you got a negative feedback. How well do you think, how much, if that's the way you based your attitude and your behavior on, how often do you think you're going to continue doing that when you get negative feedback? But if you did it for yourself and you said, I want to have better energy, I don't want to have diabetes, I want to lose weight, feel good, all these kind of things. If you do that, and you feel those positive things, and you can look at yourself in the mirror and say, I feel positive about me, and I did this. Dr. Curtis didn't do this. Nobody else around me did this. I just took some basic principles, acted on them, and now I feel better, and I'm working in a positive direction in my life. That's for you. You're the only one that has to, feel good about that. No one else. You don't need anyone else's approval. Be careful of your attitude. Be careful of why you do what you do. Have your own reason. You deserve to have your own reason. Lastly, I want to end on this, and before we get into our Q&A, I want to end with the concept of a long-term approach. I taught you in this class about good fats, proteins, vegetables. I taught you about how the human body actually works. You can go off into the weeds. You can study fad diets. You can pop pills. You can do anything you want along those lines. But I can tell you that if you'll do what I'm saying right now, if you'll be physically active, get proper amounts of sleep, you eat fats, proteins, and vegetables primarily, and you monitor your stress, you will look at the lifestyle factors we just talked about. If you will do those things and you will commit them as part of your lifestyle, and that includes exercise, if you do that, that is a long-term approach. That is not a quick weight loss scheme. That is a long-term lifestyle. This is what I do. This is who I am. I am a person who exercises. I am a person who eats a specific way. I am a person who practices intermittent fasting because it's the way I was built. It's the way I am. I can do it. Makes me stronger, makes my metabolism better, makes me live longer according to the research. If you do those things, that's a lifestyle change. That's a directional, took a different path down the road instead of staying on the same path. Long-term approach is what matters. And that's why I teach people to change their diet and lifestyle, not give them quick gimmicky things to lose a few pounds. So I hope this has been helpful for you. I'm going to end there. I'm going to leave this I'll allow for some Q&A here for a few minutes. And I will leave this class open, meaning I will check in, answer questions. So if you go to the question or the chat section and you ask questions there over the coming weeks, I would be happy to answer those questions. I also would encourage you, if this class was helpful for you in this community, please share this with other people that you think it might benefit, because the class is going to be here. And if you think someone else needs to hear a message like this, share it. That's why we built this content. And I appreciate the people that share this process journey with me going through these topics. It doesn't matter whether there was one person or 100 people listening to this. This message is the same. and other people can hear it and learn from it. So I encourage you to share that with anybody that needs to lose weight, anybody that's been concerned about, I think I'm going to develop diabetes. This would even help someone that has diabetes, although I've got other classes coming down the pipeline that are much more geared towards hardcore, reversal of diabetes. But I'm going to go ahead and stop talking, and I'm going to go ahead and listen. If Melissa's collected any questions, welcome to start firing my direction. I'll hang on for a few minutes here. Melissa, I don't know if we had set up the chat area where people could ask questions there, but if that is, feel free to start.
Yeah. I'm looking at the chat. I don't see any questions just yet.
Okay.
So we're just kind of waiting on that. So 7 to 9 hours of sleep is what you recommend, correct?
I do. The research is very clear on that. And I will put a link in the show notes to the podcast that I did specifically on that topic. I did a book review. It's everything I know about sleep, and it's really eye-opening. And I was actually shocked at how little I knew about sleep and why we sleep coming out of medical school 20 years ago. And the research has really come a long way. Sleep is a big one. If you're not sleeping, you're going to have health issues. It's just a fact, including dementia and all kinds of other stuff that I didn't even mention during the talk. What else? Okay, well, if I don't have any questions at this time, I want you to remember that you can go to the chat section, ask away. If it seems like something you want to ask me that's more, direct or something like that that you don't want to share, although I think it helps other people to share questions, you can send me a direct message if you want. But I thank you all for listening and following through this program. If for any reason you'd like to add some comments about the class, or suggestions, feel free. Anything's I'm pretty thick-skinned, so whatever seems to you think might be helpful, let me know. Okay, I'll go ahead and sign off for now. You guys take care and have a great week.